I appreciate all the very intelligent conversations that we've been having on the floor, the very respectful debate that we've been having. And I want to, applaud the author for trying to tackle a problem that resonates with people in the state of California. I appreciate his courage because he's tackling an issue that is huge. And we certainly haven't had good examples set for ourselves. And the reason why we haven't had good examples at the federal level is because we have a we versus them attitude. The same attitude that we see here in the California state legislature. You see, when you have a Republican and a Democrat coming together and sharing ideas and compromising, most of the time when there is a bipartisan solution, we can get things done in the state, in the country. That's why when I served on the Board of Supervisors, it was nonpartisan. On a city council, nonpartisan. We got stuff done. And, I was never a big fan of Obamacare. It was rushed. It was passed without even the majority leader reading it and saying, we'll learn what's in it after we pass it. And all the promises that were given, even the president saying, I will promise you you can keep your doctor, I promise you you can keep your health plan, I promise you your premiums are going to come down, we know just weren't true. Now, that was a campaign issue during the last presidential election. Now, I want to say something to my colleagues on the floor. I am not a fan of the Republican version to repeal and replace Obamacare, because I think the Republicans are making the same mistake that my colleagues on the other side made when they passed the Affordable Care Act. They did it without consultation to the other side to make it bipartisan. I, for one, believe that everyone that has a pre-existing illness should get health care in this country. I am, for one, that believes if you have a catastrophic illness that you should not lose your home. You should not lose your livelihood. You should not have to go into bankruptcy. And I also believe that if you are unfortunate from an economic standpoint, that you deserve to get quality health care. Now, we'll see where this goes. But responding to just a few of the comments that have been made on the floor, my good friend from the San Fernando Valley said we need to vigorously debate this bill. We need to vigorously ask hard questions, and then we'll see whether we got it right. My friends, we do. We do. But after we learn all the facts about how this is going to be implemented, about how it's going to be paid for, can we actually come together and vote for a bill? I thought that when we came here, I've been here 2.5 years now, that there were certain ways you got a bill to become a law. You authored the law or the bill, you went to committees, and hopefully you got it passed out. If it had a fiscal impact on the state of California, it would go before the Appropriations Committee. If you could find a funding source for the bill that made sense, it would pass out of appropriations, come to the floor, and we know how the rest of the system works. When we entertained SB 1, I don't think it would have gotten out of appropriations if we didn't have a funding source for it. We may differ on how that bill should have been funded, but we had a funding source before it was approved. Would we encourage a millennial just graduating from school and being enamored with a Tesla vehicle, going into a Tesla showroom after just getting their first $30,000 job and saying, I love that Model S. I want to buy that Model S. Where do I sign up? without any consideration about how that millennial is going to pay for that Model S as he drives it off the showroom floor, only to get sticker shock and figure out how to do things later. Before you pass a law, we got to figure out how we're going to fund it. You know, it's interesting that because of the partisan nature of the legislature, if you just took 5% of what this bill will cost, we could have passed probably every Republican bill that was not a flame-throwing bill, that was a good bill, maybe to help veterans, to help senior citizens. But many of them were killed because of financial considerations. But yet, today, we're willing to pass a bill that is going to cost $400 billion. Put your name on it by voting yes, send it to another house, and let them manipulate that bill, and ultimately pass it without having the protections that I think many of us are very concerned about. You know, you have 3 healthcare professionals that are in this legislature. This just doesn't happen by chance. We have to be elected. Only 40 of us in the state of California, here in the state Senate. Between the good senator from Sacramento, the good senator from Covina, and the fair senator from Temecula, between the 3 of us, we probably have 75 years. We all have doctorates in our respective professions. 75 years of how to deliver appropriate, comprehensive, and efficacious health care to our constituents. Now, maybe my other 2 colleagues were asked to participate in this bill, which is 38 pages. I certainly wasn't consulted. I would have liked to have been consulted. I'd like to have been a part of a solution. I came here to be a part of the solution and not part of the problem. I've heard about healthcare in other parts of the world. Yeah, you know, they can do things a little bit cheaper in other parts of the world. But you know what? When people have a serious illness anywhere in the world, where do they come? They come to the United States of America because we have the finest hospitals, we have the finest doctors in the world. And why is that? It's because of a capitalistic term called competition. We have hospitals that are competing to find those cures, pharmaceutical companies that are competing to find the remedies. Where in other countries, they don't have hospitals competing against each other for service. The pharmaceutical companies, by the way, are told what they can sell those medications for, or they just can't sell them in those particular countries. Look at the cost of Sovaldi in France versus the cost of Sovaldi in the United States of America. You'll see a dramatic difference in the cost. Even the Appropriations Committee staff opines that this is a $400 billion bill. And that amounts to, my friends, $22,000 for every man, woman, and child in the state. That's more than 2.5 times our general fund. The bill's goal is noble. Everybody wants health care, and we know everybody needs health care. It's been marketed that everything is going to be free. Free copays, free premiums. But those of us that have been in business and lived around the state, this country, as long as I have, you know that there is no free rides. That somebody's going to have to pick up the tab. This bill, as written, will force people out of their current healthcare system and embracing a fully governmental-run system run by government bureaucrats who have failed us too often. When, my friends, have you ever seen, give me one governmental program that has been cheaper to run than the same program in the private sector? For those of my constituents that have Kaiser, if this law gets passed, Kaiser said at the hearing, committee hearing, they will close their doors in California. Aetna will leave. HealthNet will leave. Blue Cross, Blue Shield, nonprofit, hospitals. So much for freedom of choice of picking your physician, picking your hospital. And what track history does the state of California have in the deliverance of health care? It's distressing that over a third of our population is currently enrolled in the Medi-Cal program. I think when I graduated from pharmacy school in '81, and maybe 12% was enrolled. These are more lower income people that are in the Medi-Cal system. What does that say about the economy in the state of California? We've seen a growth in poverty, we've seen a growth in homeless, and frankly, why? Well, it's been the policies of this institution over the past 3 decades. Many people that are in Medi-Cal, they have to wait sometimes months to get an appointment. Why? Because doctors won't take it. They get paid $17 a visit. It doesn't pay enough for doctors to do the job. It's less than it costs to have a pizza delivered to your house. Patients often end up in emergency rooms because they can't get an appointment to see their doctor, and we know that the costs of going to the emergency room are significantly more. Even though we can say these so-called people have insurance, they really don't have access to real care. So when we can't deliver medical services for 14 million out of our 40 million people, what makes you think that we can do it any better for 40 million people? I would opine without a lot of thought and a lot of collaboration, it will fail. Under this bill, people who currently have employer-provided health care will be forced into a state-run system, again, presumably modeled after Medi-Cal. Even worse, though, is the fact that SB 562 will create a capitated fee-for-service program that will make it more difficult for doctors to keep their doors open and to keep providing services to their patients. And even if you agree with the concept of single-payer health care, this bill has several fatal flaws on the health coverage side. There is no specific provision in this bill to prevent fraudulent use of the healthcare system. There is no provision to prevent people from overusing the healthcare system for trivial issues. How are we going to ensure that people in rural areas, like much of my district in the eastern Coachella Valley, are going to have doctors available to them at the capitated rates that can be cut on a yearly basis if the economy goes into recession? If we don't learn from history, we're doomed to repeat it. We haven't even restored the Medi-Cal cuts after the 2010 fiscal crisis in the state of California. And I'll tell you, if doctors do get a Medicaid fee of $41 a visit through this ultimate bill, if it becomes a law, and we go into another fiscal crisis, the first place the institution cuts is healthcare providers, and you will see physicians flee this state. Not to mention, if we have a free healthcare system, we will be a magnet that is incapable of providing actual care to people because doctors won't be able to afford to stay here in business because the volume of patients they'll have to see is exorbitant. We'll have a system that encourages people to come to California from all over the United States and the rest of the world to get their free health care. Now let's consider some of the more immediate and practical problems with SB 562. First, we need to get federally approved waivers from the Affordable Health Care Act. And I think that many of us that are realists understand that this is probably not likely to happen with the current administration, especially with California's history over the last few months of kicking the Trump administration in the groin. Second, this bill would need to suspend Prop 98, the constitutional provision that guarantees schools around 40 or 50% of the general fund revenues. Third, this bill will need to get rid of the GAN spending limit that limits the growth of government spending on a year-to-year basis, which will be very challenging. And fourth, this bill will undo Prop 30 that promised counties certain funds be dedicated to public safety. So now let's assume, on a positive note, that the federal government gives us the waivers, and voters vote to gut Prop 98 and get rid of the GAN limit and strip local government of what little protections they have to keep us safe. Then we're forced to ask, how are we going to pay for the bill? Right now, California is the highest tax state in all 50 states. We have the highest gas taxes in the country thanks to SB 1. We have the highest income taxes in the country, 13.3% for the highest earners, but even those just making over $50,000 pay 9.3%. This bill will potentially add 15% to middle-class taxpayers. That's $6,750 out of his or her pocket. But it's worse. This taxpayer's employer will also have to pay potentially 15%, and that's assuming the person will still have a job, because from what I've been hearing, there will be a lot of companies closing left and right if this bill becomes a law. My friends, we know there's a problem with health care, but SB 562 is not the answer. It's not cooked. It's raw meat. We need to increase access to care. Let's make Medi-Cal work before we expand it to 100% of our population. But reimbursement rates need to increase to entice medical professionals to participate. And certainly fraud will need to be reined in. The system needs to prove its ability to deliver adequate care and at a reasonable price. My friends, if you like your doctor, you'll vote no on this bill. If you like your current health care plan, you'll vote no on this bill. If you want California to be competitive in the job market, which is very challenging these days, you'll vote no on this bill. My friends, I'm going to quote Thomas Sowell, who said, "People who believe in universal health care show remarkable little interest, usually none, in finding out what that phrase turns out to mean in practice. In those countries where it already exists, such as Britain, Sweden, and Canada, for one thing, universal health care in these countries means months of waiting for surgery that Americans can get in a matter of weeks or even days." But my friends, I'll close here in a second. I just want to say that it's bills like this that instill fear and anxiety with a very nervous business community. We are under the radar. Many small business owners in my district are exploring how to leave the state, how to take their business with them. It doesn't make big news like when Nestle leaves or Toyota leaves or Sherwin-Williams Paints leaves. It's going to be a silent exodus. It's only going to catch up when we see that our revenue receipts don't come in as expected. But this is a serious business. It sounds great, but this bill is something that we just cannot afford, that we don't need, and most people, at least in my district, don't want. I would be delighted to work with the author, with my healthcare professionals, not pass this bill today, and let's work on a bipartisan approach to setting a model for how partisan governments can work, with the common goal of not scoring points for the Democrat Party and not scoring points for the Republican Party, but scoring points for Californians and setting an example for the rest of this country on how democracy is supposed to work. I would really appreciate that opportunity. For those reasons, I urge a no vote on SB 562.